In the heart of healthcare, a powerful force often goes unnoticed: human connection. Beyond medical advancements and technological breakthroughs lies a network of individuals whose relationships shape the industry.
Healthcare leaders today are very challenged by many factors that affect our workforce. Our biggest factors are retention and certainly staff engagement. Staff engagement is extremely important, especially with all things around quality and safety. We want our healthcare providers, our caregivers, to really own their work and have accountability in the care that they render. So I think it's important that we foster a collaborative environment, one that they feel valued, one that they feel appreciated, and really understand the expectations around the care that's expected for those patients and families. That takes a lot of effort in building relationships.
For decades, the focus has been on putting the patient first, and rightfully so. But what if we could slightly adjust the lens? What if by nurturing the well-being of our healthcare workforce, we could create a more harmonious and ultimately a more effective system for everyone?
Well, they say happy employee, happy patients. And if employees are quietly quitting, or if they're just showing up to do tasks and not relating to patients and families, it really does affect recovery of patients, because well-being is so important, not only for the employee, but for the patient and family as well. So patient satisfaction affects reimbursement that hospitals get. So it's all about happy employees, happy patients and families, happy physicians, etc.
Staff engagement has always been important, but never more than today. I think it's important that we engage our caregivers early on in their career with us, help them to understand how valued they are, how integral they are in everything that we do, whether you are a nurse at the bedside, a physician, or certainly any part of our multidisciplinary team. We all work together, and that staff engagement is extremely important.
So it's utilizing what we call shared decision-making or shared governance by empowering the clinical nurse or the clinical pharmacist, respiratory therapist, etc., to come up with the solutions to the issues. So if you create the ownership in the individuals doing the actual work, they're going to support it. They're not going to fight against it. And patients are going to be satisfied, and so are employees. They will be engaged.
Most people that enter healthcare do not enter into healthcare for the technical aspects of care. For the vast majority of people who enter into healthcare, they want to help people. And yet, in healthcare, our tendency is to grade people on their technical aspects. I think that really the way forward is really the merging of both the technical care with kindness, compassion, and empathy.
Creative Healthcare Management believes the key to a thriving healthcare system lies in the power of relationships. We partner with organizations to build a culture of excellence.
When we talk about the support that we have three major service lines, one of which is competency and professional development, and that's working with the organization to document the required competencies to help people grow professionally, even including some motivational aspects. Then we have the relationship-based care, we call them service lines, and that is where programs, workshops fit under, but it's also helping organizations look at their care delivery model and determine what's best for that particular hospital and that patient. And then the third service line is called Cultures of Excellence, and it's working at a cultural level to engage staff and get them ready and prepared for national designations. Magnet recognition is one of them. Pathways to Excellence is another one. Transition to Practice is a third one that we work on.
Partnering with a very trusted organization like CHCM has benefited our organization in that they have really been connected to our mission. If you look at their care model, they keep the patient and family at the center of all things. And that's one of the reasons why it's worked so well for us, because that is our mission, keeping the patient and family in the center of everything that we do, every decision that we make. That being said, working with companies like CHCM has been very beneficial to our overall culture. It has increased our employee engagement through, very importantly, shared governance. And having the opportunity for caregivers to have a clinical voice, share their thoughts, share their concerns, and be a part of the decision-making moving forward has really benefited all things around a more positive culture. It's really important that you recognize, to be successful in achieving your journey to excellence, that you need a partner in creative healthcare management. They have the expertise, they have the ability to partner with you to transform your culture.
Creative healthcare management has a lot of opportunities for organizations to really engage employees. I already mentioned the shared decision-making, shared governance, but we also offer some experiential workshops, one being Reigniting the Spirit of Caring. Another opportunity is a program that we do called See Me as a Person. We also do leadership development programs, and we do a workshop called Leading an Empowered Organization. And all three of those really end up being feeders or foundational work for what we call relationship-based care. Care of self, care of colleagues, care of patients and families, and we now realize it's also care for the community as well. We will partner with you to improve your patient experience, to improve your employee engagement, and ultimately to improve your financial reimbursement.
Ready to cultivate a more connected healthcare team and enhanced patient experience? Creative Healthcare Management offers innovative solutions to elevate your organization. Visit chcm.com to learn more.